Hello, everyone. Thank you very much for joining 18th FIS Youth and Children Seminar. We will wait a couple of minutes for all participants to log in, and we will start shortly. Thank you. Hello, everyone. I think all our potential participants are joining slowly, so we can start with introductional slides and slowly dive into the 18th FIS Youth and Children Seminar. So I would like to thank you all for joining the 18th FIS and Youth and Children Seminar. And as it is indicated on the slide, we will discuss and present to you today solutions for integrating COVID-19 measures. Before we go to this, I would like to introduce you some housekeeping rules so that we are all able to participate in the best possible way. Please keep your microphone and muted and your camera switch off, and please be free to ask any questions during the presentations in questions box, and afterwards, when the agenda come to that point, we will be more than welcome to answer all your questions. If all questions will not be answered, we will collect those questions and we will answer them later, which will be sent to all nations that are participating on this seminar. As agenda indicated, we have today really great presenters, and I'm sure that you will enjoy listening them as well. You will get some very important information that will help you to prepare coming season and organize very good competitions. On the end of the seminar, as I indicated, we reserve some time for your questions, and please be free during the seminar to place your questions, and we will collect those and try to ask our panelists afterwards. Coming into the introductional part of the seminar, I really would like to inform you that this is the third webinar that we are doing for the topic of COVID. Two previous webinars were done in relation to the World Cup, World Championship organizers, and this one is more related to the FIS and the children competition, so that we can touch the base today those questions with you and to provide you some important and I think really valuable measures that you can integrate in delivery of the competitions. As you already saw, FIS is putting a lot of important measures to different levels of the stakeholders in order to make sure that all stakeholders can participate in the best possible way. We are also inviting you, if you have any doubts, any questions, to contact us at any time, and we will be more than happy to help you or to issue any letters or whatever is needed in order to make sure that all athletes, jury, and other stakeholders are safe and sound in the different locations. So please be open, contact us, and we will try to help you as much as possible. Recently, this is something for the organizer, and I thought it will be important to mention here. On the committee meetings in the last week, it was discussed about preventing for the technical delegates of the jury member if they are not able to attend different competitions. So it was agreed that on the World Cup level and the Europa Cup level, TDs will remain internationally assigned, but for the FIS races and children competitions, if the regulations, local health regulations do not allow, the TD can be chosen by a local or regional contingency plan. Each organizing committee is required, and this is something that we are really insisting to, together with a local health organization, create a document that is called COVID-19 prevention measures document, which will indicate all requirements for all participants that will come to the different competitions. This document should be presented to FIS approximately 5 weeks before the competition, in order for all participants to be in position to prepare and to participate in the best possible way. Further to the document, it is recommended that we receive this document 5 weeks before the competition. But I would like to say, for the low-level events like children races and FIS competitions, this timeline could be shorter. But I think it is really important that we indicate that this document is really important to be sent to FIS in order to be uploaded on the calendar page where all other participants can be see it. Further to World Cup events, World Championship events, I just want to present this model that is presented by FIS to all organizers, which we do not expect to be integrated and included on the FIS level events. But what is important when you are discussing with your health authorities and creating the measures that will help you to deliver competitions in the coming season, please have in mind that certain distance needs to exist, and we need to protect our athletes and the teams from other groups that potentially will not be required to do PCR test or any kind of measures like tourists. And we all know that on low-level events, mixing between the tourists and athletes cannot be avoided, but in the situation of the coming season, we need to be a little bit careful with those measures, and for that reason, have this model in mind and try to prevent and to protect all the participants of the competitions, because they put a lot of health measures in place in order to arrive to your location and the competition, so they should feel protected. for the end, I just would like to stress that FIS really put a lot of time and a lot of measures and energy in creating a lot of prevention documents and the measures for delivering successfully not only World Championship and World Cup competition, but as well all other competitions. And we are looking into that. Many FIS competitions will be delivered in the safe and sound environment, and for that reason, we all need to act together, be very disciplined, have tolerance, and be flexible in order to make sure that all the competitions are delivered in the best possible way. We can only do this together, and we need to work together in order to successfully finish this very uncertain season that is coming in front of us. Now, I would like to give you the floor to my colleagues, Sarah Fusek, FIS Integrity Manager, and Dr. Jenny Schutt, Vice Chairs for the FIS Medical Committee, and they will present you the following slides about prevention guidelines and some good, I would like to say, examples how you can prevent your competitions and deliver them in the safe possible way. Thank you, Sarah. Jenny, the floor is yours.
Many thanks, Dimitri. As agreed with Jenny, I will start up our presentation, and I'll take pleasure to guide you through the document on FIS COVID-19 prevention guidelines. The first question that we have been receiving recently and also regularly is, who are the guidelines for? And the answer is very simple. The guidelines are for everyone in the skiing and snowboarding family. Yes, a lot of the elements might be more applicable to the level of World Cup or World Championships, but equally, a couple of elements or many elements are equally applicable to all FIS level competitions, depending on the circumstances that certainly needs to be taken into consideration. As Dimi outlined, my name is Sarah Fusek. I'm Integrity Manager at the International Ski Federation. And next slide, please. Thank you. A quick outlook what we are going to tackle for the next 10 to 20 minutes. We're having a quick look into development of the document of the guidelines, how it was developed, which experts, which people have been involved, where did we take the expertise from, where can we find that document, but not only that document, but a lot of other sources that might be valuable to look into. I will also take a quick look in the main messages, in the main points of the document. And my presentation will be followed by Dr. Jenny Schutt, Vice Chair of the FIS Medical Committee, who will then present about the practical aspects and recommendations on how to manage the risks. And I'm sure no one could do that better. She, of course, knows your circumstances much better than myself. And I'm sure the majority amongst the participants today know her very well. And finally, I will conclude with underlining what Dimitri said in his introduction, that we are here to support you as best as we can. Next slide. A quick look back into how these guidelines were developed. First of all, we all remember beginning 2020 when the pandemic started and hit Europe and North America, and it led to the situation that FIS had to cancel the last events of its season. We wanted to get quickly prepared before the summer to inform our stakeholders on how we can get prepared and which actions we can take jointly in being prepared of starting a new competition season. A first version was published in June, we call it the summer version, that included basically a couple of really basics on what the virus is. It included basics on hand washing, on how to wear masks, on how to clean, and all these different things. So really basic information. But already at that time, it was targeted to all stakeholders. Certainly, the first target group were the event organizers, as being those in first instance responsible to set adequate measures to mitigate the risk of infection and for safe competitions. But certainly and equally, everyone participating in an event is equally responsible to behave in a disciplined manner, and therefore as well a target of these guidelines. We also took into consideration the feedback we have received from our race management at the end of last season on what their main challenges were and what challenges they see upcoming, and we tried to address them properly in that document. Certainly, there were also the recommendations and the knowledge expertise collected by the WHO, the World Health Organization, as well as the IOC, the International Olympic Committee, as well as the expertise that other international federations were sharing with us, especially those who were scheduling events already in the upcoming summer. The FIS has then set initiative to form kind of a COVID-19 different groups. There was first of all the COVID group, including the race directors and medical staff, but it also created a so-called FIS COVID-19 medical support group that involved a couple of members of the FIS medical committee, as well as a liaison member to an International Olympic Committee working group, as well as a separate expert that was responsible to advise FIS on hygiene and testing strategies. During the summer, after the ski jumping Grand Prix in Wisła, Poland, we have had a lot of lessons learned, and therefore we have worked on a winter version that we published last month in September. And that basically had a lot of changes, and it has been removed all the basics on the virus, the basics on hand washing, all this which we all already have learned very well already, and we tried to make the document more compact. We also removed information on discipline specifics, and these were then taken over by the FIS disciplines and have been presented at the committee meetings. Also, for example, cross-country skiing and Nordic Combined took the initiative to set up a separate document focusing on sport-specific recommendations and lessons learned based on the guidelines. Next slide, please. Yes, here the list of experts that were involved on the FIS level. I'm not going to read them down. There's all names that are, I'm sure, well known to you. But as I said before, a dedicated medical support group, as well as a dedicated expert to advise on testing and hygiene strategies. Certainly, and I'm not going to dive into a separate document that is called the FIS COVID-19 World Cup Risk Management and Testing Protocol, because all my colleagues said I'm not allowed to use the terminology of protocol more than 3 times because it will get too technical and everyone gets scared of these measures. But the message is pretty much simple, and that is really more focused on the higher World Cup level, which means like more strict measures in terms of testing and hygienes and protocols. But this protocol was designed to have a standardized approach throughout the season, but we learned already that this will be very difficult because at the end, it will always be the local health rules and regulations that will prevail. Next slide, please. Where to find the information? I hope everyone is aware that FIS has created a COVID-19 hub on its website. We will share this link also when we share this presentation with you afterwards, so you don't need to write that down. But this really combines all of the resources that FIS has been published. So this is a really good spot to find the latest versions of the documents. It also includes, since last month, a frequently asked questions document, which is regularly being updated depending on which questions we receive. We try to address them in that service box in order that others can benefit from the questions that other stakeholders raise. Next one. What are the main messages of that document? These are guidelines. This is not rules. This should help you to give the greatest possible protection for everyone involved. Message 1, plan in advance. Draw up a good concept that is drawn up based on the assessed risk. There are a lot of sources on how to do that. No one needs to reinvent that wheel. And most probably local health authorities are well aware with that and who will support you in doing that exercise. Only if you know the risk, you're able to then adequately react with a specific concept. There is no one fits all. There's a lot of factors that needs to be taken into consideration. What is the level of international participation? Where is it located? How is there travel? There's a lot of these factors involved in such a risk assessment, and that is a really helpful basis to see which areas must be tackled from the perspective of an event organizer. There is a lot of simple measures that are extremely important, very effective, and inexpensive. And we will hear this from both my fellow speakers, Jenny, as well as then from FIS ski jumping race director Sandro Pertile afterwards, as well as athlete commission member Yernier, who will also follow, and I'm sure everyone will underline that the simple measures are those who are most important. What we have done as a must on the World Cup level is that each organizer needs to assign a person to serve as the COVID-19 health coordinator pre and during the event, and that is recommended for every event that is taking place. And the main task of that person is to have a good and regular exchange with local health authorities, which are those who always are up to date with the latest status, development on travel restrictions or other local regulations that need to be complied with when staging an event in a respective country. Communication is very important, meaning especially communicate with your participants prior to the event on what you have planned, which additional measures you have been planning for the event, so that the teams or other stakeholders or other participants feel safe to arrive to your event and feel safe to move around your event, but also that they know how they need to behave and how they need to follow in certain circumstances, especially when it comes to health symptoms, to illness symptoms. It must be very clear for each participant which way to follow, to whom to report, whom to contact, and the organizers need to facilitate a good and direct contact to medical facilities, medical care. And then education. And with education, I mean, we all know about hand washing, hand sanitizing, we know it, but we need to remind everyone, including ourselves, every day about keeping up with these recommended simple measures. So education will be key pre as well as during the event. Thanks. So basically, I'm concluding with giving you the main message. It's all about change of behavior. It's not about setting up only a testing strategy and putting up the most strictest measures, but it's about communicating and educating that everyone is in the same boat, needs to change his behavior and carry the same responsibility of all the stakeholder groups. Many thanks for your attention, and I'm passing over to Dr. Jenny Schutt.
Hello, everybody. Thank you, Sarah. Thank you for a very clear description of what is involved. I'm just going to focus a little bit more on the practical aspects of managing, controlling the risks of the virus during FIS or national events. I've tended to focus from the point of view of the event organizer, but you can extrapolate from what I'm saying, take it to how you manage your teams, how you manage your training camps, and so on. They're really the practicalities of dealing with this, this pandemic and running successful and safe sport events. Just the really quickest summary on the first slide. The ways we can mitigate the risks I've listed. The physical distancing evidence is a little bit vague. Certainly the World Health Organization study, in one of their studies, they gave a very clear estimate of the risk of being 1 meter apart, where the risk of transmission is 12.8%, at 2 meters, 2.6%. It's clear that the way the disease was looked at initially looked at transmission by the larger droplets that are emitted when you cough or sneeze or shout, but it's now well recognized and scientifically shown that it is also transmitted by aerosols, which are very fine droplets, not visible to the naked eye, that can travel as far as 7 or 8 meters. I think most of us would recommend a 2 meter distancing. And obviously the transmission by droplets and by aerosols can be mitigated with masks, face coverings. Droplets fall on surfaces. It's well recognized that you can collect infection through touching contaminated surfaces. Therefore, regular cleaning of the surfaces is important. And hand washing, I think, I'm probably going to say that more than 3 times during my short presentation. Next slide, please. So there are things we can control. We can start with symptom-free participants, and I don't just mean athletes, I mean organizers, parents, coaches, managers, media. A lot of our events at the lower levels don't have huge media presence, don't have huge spectators. We can in any case reinforce the messages of distancing, masks, hygiene measures, cleaning surfaces, hand washing. We can provide hand sanitizing liquids, dispensers at all suitable points. But you will say, well, of course, we've got advantages. It's an outdoor sport. It's well ventilated. It's not a contact sport. I think I've just put a little question mark by the cross events. There may be a bit more close contact there from time to time, but basically we're out in the open, individuals competing in an outdoor sport. The next slide, please. So everything should be fine, but I've listed some places, some areas of events where contact may be a little bit closer. And I'll go through some of these in detail a little bit further through the presentation. Team captains meetings, often very crowded. Transport, accommodation, award ceremonies. I mentioned start huts because as soon as I think about the transmission, I think about a start tent with a couple of coaches shouting at their athlete to go for it. And you have a start referee and a starter maybe inside the hut who are placed at risk. Spectators and media, I think I'm not going to go into that for this level of event. But I think the things we need to be concerned about in these closer, more confined areas is that the droplets that I mentioned are emitted in a gas cloud. If you cough, it's pretty fast. If you sneeze, it's even faster. If you shout, it's quite fast. When the cloud slows down, the droplets start to fall, and at that point, ventilation makes a big difference. So if you do have a meeting in a room, you need to think about ventilating the room. You need to think a little bit about exposure time, which may increase the risks, and also about the number of people in that room. I think I will come on to talk about some of these in a little bit more detail later. But for now, just to say that to recommend strongly that you do draw up a risk assessment for each of these areas of events. If you could go on to the next slide, please. I'm not sure how easily you can see this. It's an extract from a paper in the British Medical Journal. It's a risk assessment chart for transmission of COVID in different situations. If you go to Twitter, there's a hashtag COVID risk chart. It's quite a useful way of looking at assessing the risks. Scientists among you will have already noted it's qualitative, it's not quantitative. So it says distance, close proximity or further. It doesn't say what the distance should be. It doesn't talk about the length of time of exposure, but it does give you a good green, amber, red chart that shows you where the risks are highest. For those of you who are interested, hashtag COVID risk chart has been translated into more than 30 languages and is available, and I think might form a very useful base for your risk assessments in the different situations in a ski event. Next slide, please. So we would recommend that, as for the World Cup, at each level, there needs to be some pre-event information and guidance available to all participants. I think Dimitri said at the beginning that will need to be sent in to FIS for FIS events. The important thing is that this needs to be agreed with the local health authority or the national health authority. As we've said a few times, it is the local health rules that apply. They may be different to the FIS testing protocols, but on the whole, they'll be very specific for the nation and for the region. As far as the World Cup goes, there are strict testing protocols. That isn't going to be the case for other events, and that we would suggest that it would be a good plan to get a declaration from all participants or from the team captain to cover all people in his team, so not just athletes, but athletes, managers, coaches, any parents who may be staying with the group, that a health declaration to say that they are symptom-free. The team captains need to know where their athletes have been in the previous 2 weeks, whether they've been in any high-risk areas, and actually your regional health authority may require that information from all participants. Next slide, please. It's not a sign of weakness, it's a sign of massive strength to explain all of these things at the team captains meetings. It provides a great reassurance that you're doing your absolute best to run a COVID secure event. So information at the team captains meetings and reminders throughout the event. I've put here main competition loudspeaker. I think that's quite a good way of just reminding anyone watching the event that they should try and be 2 meters away from others. You can put posters up, you can put hand sanitizer stations at all appropriate areas. You can do what you can. Yes, of course, it isn't possible to 100% guarantee that your events are COVID safe. But all of these things, the clear explanations, the clear information, will lead people to have confidence that you're doing your best to run a safe event. Next slide, please. Accommodation and meals. We haven't, well, I think actually the FIS bubbles, the FIS snowflakes were mentioned earlier. Teams should try to stay in their own bubbles or snowflakes. That goes for traveling, for accommodation at the event. Hotels will have their own rules. I can see that Yelena has asked a question already about accommodation. I think the answer is ideally teams should be kept separately. Maybe they have their own floor. Teams, athletes, participants should be advised not to use the lifts, but to use the stairs, to keep their distance, to eat as a group. The question about masks, again, I think I'll mention a bit later, but that will depend on local rules, again, on the rules of the country in which you're competing. But teams may also have their own sensible rules about wearing masks, particularly in transport. Next slide, please. Ideally, teams have their own transport. It doesn't always work like that, but I think if organisers are arranging transport for teams, they need to consider separation of teams, either in separate vehicles or in separate parts of a large vehicle, consideration of wearing masks. As far as ski lifts and shared uplift is concerned, the local rules will apply, and I think many resorts are insisting on masks in lift queues and in contained spaces. It makes sense. Next slide, please. So if the worst comes to the worst and someone is unwell during the course of an event, I think you need to make a provision to have a space where they can be isolated. Your priority is to contact your local health coordinator, sorry, the local health authority and your LOC coordinator. And my common sense advice is to advise the rest of the team and the staff of that team to self-isolate and wait for advice. Ideally, the local health authority will have tests. Remember also to maintain confidentiality. You know, it's rather than causing panic, deal with this properly, quietly, without panic. Contact the National Ski Association, contact FIS, but until the advice from the coordinator and the health authority have produced their advice, then maintain confidentiality. Next slide, please. I promised you I'd repeat the common sense advice, the public health advice that we're all well aware of. Hands to be kept washed frequently, soap, hand sanitizer everywhere. Maintain good physical distance, masks and face coverings as appropriate and in the appropriate circumstances. I should probably have added ventilation in closed areas to that list. I think I'm just about done. There's one more slide. And this, again, has been said. In the end, all of the resources and all of the forethought, the planning, the care, and actually the money that's been spent putting these guidelines together comes down to individual responsibility, discipline, and honesty, particularly when it comes to reporting any symptoms of illness. It's all of those things. Without those three pillars, the rest will be less effective. I think that is the end of my presentation, and I just want to wish everybody good events, safe events. Stay healthy, everybody. Thank you.
Thank you, Jenny. Thank you very much, Sarah, for both of you for great presentations, and I'm sure that a lot of good tips our participants could take. And now I want to move further to our agenda, and now I have opportunity to introduce you our race director for ski jumping, Sandro Pertile. So, Sandro, please, the floor is yours.
Thank you very much. Good morning, good afternoon, good evening to all of you. I'm really happy to have the chance to share with you some experience that we gained during the last summer season in our first event after the COVID-19 outbreak. So just a quick introduction about the ski jumping for those of you that are not expert. What we organized during the summer season was a FIS Summer Grand Prix event. The Summer Grand Prix event is held on plastic, as you can see from the second picture. The lowest one is a different material, but the athletes are the same, the sport is the same. The only big difference is the surface where we are sliding. Ski jumping competition are really important for us as a pre-test for the season, so we can test all the adjustment of rules in preparation for the winter season. And this year, in addition to this special task, we had also the opportunity to test our new measure for the COVID-19 situation. Next slide. So just to summarize and to introduce the topic, the competition was held in the weekend 22nd, 23rd August, and on the day of the arrival, we were in Poland, in Wisla. We had a local area with a green-yellow phase. The situation was moving in both directions according to the different days. We had some travel restriction in that period, and also for some of the countries that are ready to participate, we had additional requirements for a COVID-19 test. The Schengen zone was open, so we are more or less in the same situation that we have now. Of course, now we are in a little bit challenging situation with some more infection, but we are more or less in the same situation that we had in the summertime. Next slide. So one of the key factors was a good plan before the competition. So for all of us was the first event of ski jumping men after the outbreak of COVID-19. So you can imagine that everybody was under pressure, was really watching carefully everything around us. We had a very intensive exchange of information between the LOC, the local organizing committee, and FIS. Every few days, online meetings to evaluate every possible scenario. We were sharing documents together in order to be ready. We divided our different areas of work. So a focus was for the hotel, the second focus was for the venue, and inside the venue we divided all the sports zone. And for every of these section, we went in details discussing how athletes, coaches, media, official should behave. Next slide. And then we went into the consideration that the basic point for our plan were the basic rules. Keep distance, clean hand, use mask. This was immediately from the first day of preparation the basic point, and we were trying in every area to keep this basic rule. Then the local health authorities were ready for also in case of infection. So we had a dedicated ambulance, an isolation room, and special staff ready in case of the COVID-19 infection, both in the hotel and also in the venue. And it was really clear from us that we needed a separation of the different groups, mainly the team area from the media zone and from the spectator zone. And we had in that event 999 spectators per day. Next slide. Here you can see with some pictures some practical example. On the left side, the team captains meeting. You can see we had the distance. Every person was wearing the mask. And in addition, we were inviting only one coach per team, and we were providing a streaming transmission of the team captains meeting. And in addition, we were delivering all the information like a start list and the presentation of the team captains meeting through a WhatsApp group with a normal PDF presentation. So everybody was able to follow the presentation both in the room and also in the hotel room through the own mobile device. In the center, you can see the coach platform at the takeoff. There, all the coaches were wearing masks, were keeping distance, and we created a special flow on the coach platform to allow all the coaches to move and to work in the proper way. And we decided to include a second screen for some of our working tools in order to provide the best possible condition. On the right side, you can see the position at the exit gate, 3 sitting positions for our athletes when they move out of the outrun area. They can sit down in a quiet, with a quiet solution, and of course with a distance. And the only place where athletes were not wearing masks was from the gate till the exit gate. Then they were able to get again a mask and move to the cool down zone. Next slide. We have here 3 additional examples. On the left side, the medical staff that was at the bottom of the hill, they were equipped with a full COVID-19 protection in case of any possible solution. In the center, you can see our equipment controller at the start. Since the athletes were without mask, we were including this plastic face shield for our controller at the start. And this was applying not only for the equipment controller, but also for the people that are responsible for the start procedure. And on the right side, a meal box. The organizer decided to provide a closed meal box for the participant in order to avoid any contact for the food. Next slide. Here you can see some other example. In Wisla, we have the corridor of the athletes that is really close to the spectators. So the organizer were preparing a transparent plexiglass wall. And anyhow, we were still in the situation that athletes were really close to the fence. No possibility for a touch, but at the same time, with this transparent wall, fans were really able to be close to the athlete. On the left side, you can see the Olympic champion Camille Stoke, and also on the right side, a very fun image, two hands, but of course separated by a plastic wall. So keep the distance, but we want still to be social. Next slide. I share with you some personal observation. The first is from my perspective very important. You will probably have the same feeling during the winter season. Of course, the first event during a COVID-19 situation can be a challenge because we don't know what we can expect. But I can tell you that after a few hours, I had a very positive feeling. And during all the event, I was having always the feeling to be safe. And this was a really important experience for all of us. The second point that I want to share with you is that for the athletes, for the team staff, for all the people that were around, for the official, it was a great joy to meet again. You could see in the eyes of our athletes how deeply emotion they were, and how happy they were to be on site. And this guides us to the new normal COVID-19 life. Now we are getting used to wear a mask to keep distance, and this is our normal life. So let's try to be ready for this new situation. We can do it. And of course, what I want to underline is that the basic precautions that were our basic point in the rule or in the organization of our plan were worked well. Next slide. So just to summarize the point, what I would like to share with you is for sure that basic rules are really important. These are the base for a safe event. The second point that was mentioned already from my colleagues is that we need to be responsible and disciplined. This is our task. This is our role. So as long as we are responsible and disciplined, we can have a safe event. And our lesson in Wisla was, yes, we can. So ski jumping can have competition. And after that event, we had the additional event at lower level, and everybody now is confident that we can manage event also during the winter season. Next slide. Good.
Thank you, Sandro, for your presentation. It was really very valuable, and thank you for this live examples from the competition that you had delivered during the summer, just after the season was started, and we start putting all these prevention measures for the COVID-19. Now we are at the section with the panel discussion, and I would like to thank some of you that you have already placed your questions into the question box. So I think you are all slowly will get the answers, but on the other side, I would like to invite the panelists if they want to elaborate any of the questions in a more structural way. So please, the floor is yours, and we can slowly follow up all the questions that are coming through the questionnaire box. Thank you.
Dimitri, can I start by answering a couple of very good questions that have been put to me. One more of a comment
Please,
from Satu Kalakainen, who asked me to highlight the fact that when somebody is ill, when somebody goes into isolation, it's a physical issue, and we have to be very well aware of the mental aspects. They need support, they need interaction, and they also need not to be blamed. I think we live very much in a blame culture at the moment, but COVID is everywhere. The risk is everywhere. There cannot and should not and must not be blame attached to a particular person, unless, of course, there's been a large breach of disciplinary conduct, which has put others at risk. But normally, just make sure that you look after the mental support of those of the sick person. I do have one other to answer. Shall I answer it straight away?
Yes, please, Jenny, please do it, and then we can move to Jerne and Sarah Fusek if they can take some good questions to elaborate more closely. Thank you.
So my next question was from Emin Patacci. And it's a very good question. How do we manage the person who is at risk of transmitting the virus to others, but who has no symptoms or very mild symptoms? And this, of course, is a challenge to absolutely everybody, particularly at youth competitions, where it's well known that young athletes, young children don't tend to suffer from serious disease. They can, however, transmit disease. The answer is, I think that everybody, every participant at every level should regard themselves as potentially a transmitter of disease. We wear masks to protect others from ourselves. And I think if you regard yourself as a possible source of infection, if you encourage your teams, your athletes to do the same, then it just reinforces the precautionary measures that everybody can take. But again, there's no guarantees that we don't have asymptomatic transmitters at any of our events. Unless, of course, we test prior to the event. Now, that is a requirement for the World Cup. It's a requirement for entry to some countries now, but it's not practical to have it as a requirement, a blanket requirement for all competitions.
Okay, thank you, Jenny. You will take one more question?
Do I have another question?
No, I'm asking, did you choose any additional question? If not, to be honest, I would like to move to Jerne and just to get from him some perspective of the athletes, because he is representative of athletes on this call. So Jerne, and then we can go back to you, Jenny, later, no problem. Jerne, please.
Yes, thank you very much. Basically, I do not have much to add because all three panelists have spoken really, really well and put out all the details. Maybe at first, I would really like to thank the FIS for including us, the athletes, at these difficult times, that we can take care of our own and find a solution that works with every athlete, not only the organizers. And I have to say that I'm really pleased for that. Second of all, we athletes all want to compete, from the top level to the totally bottom level. And I think the children are the ones that are even more than on the highest level, competing with their hearts and can't wait to races to start. As for the situation, I agree that these simple tasks that we have to do, so wash hands, wear masks, and cleaning and sanitizing, are really non-expensive and essential. And I'm urging all of our athletes to be the role models and to show the people that it's not hard to wear a mask. It's just something different that we have to learn. For a simple example, you all wear seat belts in your car. but hopefully you never need it in your life. But when you do, you really need it. So this is basically the most important thing that us athletes are trying to put out. And equality, that is something that is really important in this situation. And this mental health that Jenny just explained, it's really important, especially at young children. Us on the highest level can manage isolation, but those, if they will be cornered in a dark room, it's like for them like a horror movie. So be gentle with quarantine and be nice. That's the main points I would like to put out.
Thank you, Jernej. Thank you very much. Sarah, do you see any of the questions that potentially you could elaborate in addition, besides the answer that you already has provided?
Do we have a chance to give the auditorium the chance to ask questions on like real
Yes.
time, or maybe if someone wants to raise hands, I think you can give the right that if maybe someone wants to interact with us, that would make it a bit more lively.
Yes, if someone have a
Dimitri,
question,
I think you would need to instruct accordingly. That's up to you.
yes, if someone want to ask the question live, then we would need a hand to be raised, and I will be able to include the person, no problem.
Can I just
Or maybe we have a participant that is currently planning an event in the near future. Maybe someone wants to share experience on current challenges, which would be really helpful for us to learn, because we can only improve our knowledge sharing when we get the feedback from those persons who are trying to implement these as best as possible. But we got one question that I see here. It's whether participation in FIS races should be conditioned by PCR tests, and if a nation can ski when the own country has a large number of cases, do we have the right to participate in competitions if we prove that we have not been in the country for the last 14 days? I think that's a really valid question, and the answer is also here very simple, because there is no standard answer. It really depends from which country you're coming and in which country you're going to. It does not depend basically on your nationality, but as your question already indicate, it's all about where you have been in the last 14 days that will then go to the specific follow-ups that a government would do. This is nothing for FIS to decide or the event organizer. This is a poor national regulations, but the organizer is the one who can help you to find the correct answer to that.
I wonder if I could just answer a question that I received outside of the meeting, actually, and it was about a declaration form. Does FIS have a declaration form that can be used at all events? And the answer is no. There's a process for World Cup events, but for other events, I think it has to be down to the organisers to discuss with the local health authorities and come up with the questions that they need to know the answers to. I mentioned, where have the participants been in the previous fortnight? That might be a required question. As I say, I know that some nations have drafted their own already. I know that Serbia has. I've seen that as an example. But I think it will be down to the individual events to arrange those questions, those declarations.
Okay, thank you, Jenny. I think we have one question from Laszlo. So, Laszlo, I think you should be able to talk. Check. You need to unmute the microphone if you want to ask the question, Laszlo. So please. Okay. Okay, then please come back to us later if you have any questions. Okay, so what I can see here from the questions, also there is a question from Jelena from Bosnia and Herzegovina. It's about question: are all the Europa Cup level events the same as FIS lawyer events? LOC is monitoring, and it is yes. So LOC and the local health organization needs to prepare the COVID-19 prevention measures document to send to FIS, and we will help with this, and this should be available for all participants in order to make sure that everybody arrives safe and with all the required elements. Is it PCR test? Is it any other elements that are needed in order for them to arrive to the location? So it will remain pretty much the same for all. Okay, I'm looking for. Okay, the question is it possible to DSQ one coach or athlete if she doesn't comply the rules of the organization? So I would like to say DSQ is happening only once the competition is ongoing, and we are talking here mostly about prevention and what needs to be done before the competition. So before we arrive to the competition, how we need to act and how we need to prepare in order to arrive and to apply to all requirements to each of the competition. As well, what our colleague Sandro present is how the organizing committee can organize certain elements in order to have safe athletes and coaches and all other stakeholders in the same competition. So DSQ come during or after the competition. Okay. And another question from Hungary. In the situation of the suspicious cases during the event, the FIS is able to make PCR test. So I would like to say FIS will not do any PCR test. So this is really very important, is that we have indicated today many times that in charge of each competition or each event, local health organization together with local organizing committee is putting rules and regulations together, and this is something that you will discuss directly with your local health organization, and then you will treat any suspicious cases in the way like the local health organization is required. So this is really very important. FIS is not imposing anything in regards to that. We are trying to, with these webinars, to educate the people how to act and how to prevent in order for us not to arrive to the suspicious cases. If Jenny or Sarah would like to add something to this, please. Oh, okay, sorry. Can you try now to, sorry. It looks like I pressed some button that I'm not able to unmute, or I don't know what happened. Can you try now to unmute? No, it's still not working.
Is it working now?
Now it's working. Okay,
Yeah,
please.
okay.
Please, sorry for this. Yeah.
No problem. I kind of lost my place while I was trying to.
No, I just asked because it was asked, does FIS for PCR testing posing during the competition? And I have indicated that we are advising that local health organization together with local organizing committee is preparing all the measures, which include how to treat suspicious cases. So
Sure.
this is something that I just wanted to check with you if there is anything else that you need to complement to.
Sure.
This.
I tried to add a little comment to what you were saying before about if somebody has clearly breached a disciplinary process, clearly breached guidelines for, I don't know, going to local bars, pubs, whatever, that certainly in the World Cup protocol, it allows for accreditation to be removed. And that is something, we talk about discipline, but if there are clear breaches, that is something that maybe organisers at all levels should have a look at. Skiers are athletes, participants are on the whole pretty responsible. They put a lot of effort into the sport. They put a lot of time and effort into traveling. They're not going to step out of line, but clearly there needs to be some consideration of measures if there is somebody clearly taking liberties with this, putting others at risk.
Okay, thank you, Jenny. Sophie Gritzis, I think you are able to ask the questions directly. Oh, please.
Hello to everybody from Greece. I'm struggling with issues with the new laws according to COVID-19. The venue I'm on with most of the homestead slopes in Greece is Parnassos Mountain, and I would like to present myself. I'm president of a ski club, of Athens Ski Club. Also, I'm president of the development committee of the Hellenic Winter Sports Federation. And we're struggling right now with the managers of the venue of the ski resort because they want to limit sporting people as is skiers, athletes, parents, and all these guys are us. In terms of capability of inside COVID measures in the restaurant, and so they're trying to instead of average of 5,000 skiers during the weekends, or during, for instance, World Snow Day, 6,500. They want to limit all this with 2,000 skiers today. So I'm struggling with the managers and on all levels till the Ministry of Sports and Education and Economics, and we cannot find a line of good understanding. So what I think is that us should be athletes and youngsters that belong to clubs and are groups and are clean in terms of COVID, and they come in families and everything, all this should be included independent of the whole tourist thing. So that's why I would like, I'm sure I'm not the only one asking this question. I will, I'm debating on a daily basis with these skills, because after these skills, the people, these skills, I would like very much from your. I've noted everything written down. It's already all summer, but really, I would really need a guidance which I could present them. Although in each for each was written, and I intend to have a much.
Sophie, thank you for your question. I don't think I can really answer that from a medical point of view. It's bigger than that. It's commercial. It's logistics. It's overall safety of an area, isn't it? I don't know if anyone else has any comments, but there's not really a medical answer to that.
I can only say, because I was also able to follow up besides the Sophie question, live Sophie question, I was able to also follow up on some questions that she put in a question box, and having 5,000 participants or organizing World Snow Day on the venue, on the ski resort, probably you will need to follow up the recommendations from the ski resort and their measures. So for sure, each ski resort, like any other nation, is putting all the some guidelines and prevention measures, how we need to act, how many people can be in the same spot, what can or what cannot be done, and so on. So, like here in Germany, they said that only 20% of the capacity of the stadium can be fulfilled for the Bundesliga. So technically, we have, instead of full stadium, we have like a couple of thousands of the spectators. So all this will be regulated with the ski resorts, and I think by the time that is coming, so probably month or month and a half before the event, you will enter into the close dialogue with the resort, and will be in position to understand all the measures that needs to be put in place. Also, what we have indicated here in a couple of times is that potentially what was agreed 5 weeks before doesn't mean that will happen 1 week before, because in the meantime, measures could change. And I can only give you my example that tomorrow I am invited last week tomorrow to go to visit FIS snowboard camp, but only today I will decide can I go or not, because the measures in the last 7 days between Germany and the Netherlands drastically changed. So, you know, even if we are planning something in a short notice, like 7 days before the event or happening, we still need to, at this time of the life, you know, we need to check even the morning before we start in order to avoid any uncertain situations before arriving to the destination. So I would like to say it's a good to make some long-term planning, but on the other side, I think it's really very important that we stay in touch with the local authorities and make sure that we understand all the complexity of the different situations that potentially could come in front of us. Unfortunately, we didn't give you 1 + 1 is 2 answer, no, but at least we have any answer. Yeah, but we could advise you to be flexible. Unfortunately, at this moment,
no, we are flexible, but we are debating on a daily basis, because the difference between a tourist, you know, ski resort, and a bunch of athletes and teams is that you whistle to them and they go away. Since it's not the same thing with tourists that go all around the venue, off piste, on piste, on the. We are structures as FIS, as our national association. Once we whistle, they're all gone in 2 minutes. Courses and everything is away. The difference between us and tourists, but because it's a tourist venue, like half of it, and they just accept us with the homologated slopes and la 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 la, and at the end of the day we do all the competitions there and all the expert staff is there. That's why I'm asking the question, how should we go for it? I think I'm done with, like, I'm okay. You gave me the answers I thought ahead, so I will go forward and I will contact you personally if we have any kind of comments. Thank you very much for your time.
Thank you, Sophie.
Sophie, can I just add that I absolutely support what Dimitri said. We cannot give clear answers on everything. Flexibility, tolerance, and as Yerni said earlier, kindness. These are things we have to accept. The world is not as we knew it. This is the COVID world.
Yeah, but we have kids. But we have kids here who need to train. We have it's our, like, I'm 5 kilometers from here. I live here. I cannot not support the whole thing. So anyway, I'll find the issue. I'll find the solution. Don't worry. Now I have all your guidelines. Thank you very much for that. And we'll go forward for these competitions here happening with the best way and best quality.
Thank you very much. I think we have another participant, Ken Dorothy. So please, the floor is yours if you have any question. Thank you.
Thank you very much. I appreciate you taking my question. Good morning from Vancouver, British Columbia in Canada. I'm a head coach of a U10 team at Cypress Mountain on the North Shore. I've got roughly about 130 athletes and a bunch of coaches that I'm trying to manage this year. And we've got some plans in place that we're hoping are going to work well for us. And I've heard a lot about planning and a lot about protocols that are put in place, but I haven't heard much about the results of those protocols or that planning. For instance, the event that was held in August that we were speaking of with Sandro earlier on, was there any transmission? What were the rates of transmission? Are our protocols working? That's what I'd like to know, and I'd like to be able to pass that information along to parents if I could, please.
Sandro, could you please take the question? Thank you.
Can you hear me now?
I can hear you.
Yes. Very good.
Yes.
No, I can tell you that our event was a COVID-free event. So in principle, and this is the reason why I strongly suggest to work in a responsible way with the basic rules. So we always had the feeling to be safe. We always kept the distance. Athletes were really a role model, like Yerni was mentioning. And at the end, also the media people were very responsible. So at the end, if we work in a responsible way, I'm 100% sure that we can manage those situations. But of course, we need to be responsible. This is the basic point.
Thank you, Sandro. I appreciate your answer. And was there any, just as a bit of a follow-up, did we find that there were any cases of COVID transmitted or anything like that that came up afterwards, like within the 14-day period after the event?
Okay, Sarah? From what we know, no cases at all.
Now.
Yeah, now I'm
Sarah.
here. Thank you. I would like to add, thanks for the good question. And I think this is a very important point that despite Sandro's event in Poland, we haven't, of course, not yet have any experience what the outcomes are. But this is not something that we have just took out of our fingers, but this has been discussed with experts that have been involved, for example, in staging cycling events. And of course, we've received information from there. But even though it's very important that we follow our first World Cup competitions and to see what the challenges and what the outcomes actually are. And based on these protocols or these guidelines need to be adapted based on the lessons we learn. And that's why it's also important that we have a process in place to also share that knowledge, whether that actually works. So communicating within the family will be a very important element. Thank you.
Thank you very much, Sarah. I appreciate your answers, and thanks for taking the time to put this together for everyone this morning. Thanks. Have a great day, everyone.
Thank you. I think if any of the panelists do not have anything to add as a closing word, I would like to say thank you to everyone that joined the 18th Youth and Children seminar. I hope next one will be not online but in person, because I think these seminars were really great and fantastic opportunity for all participants to meet, to talk to each other, and to exchange the knowledge and expertise in different areas that they are working with their athletes and other stuff. I can only say thank you for all your questions and participation on this seminar. And I also would like to say thank you to two of my colleagues that really helped me in lead up to the seminar, Andrew and Steffi. And I hope that we will be able to see each other next year in face-to-face seminar like it was done in the past years. Please be advised that this webinar will be available recorded, so you can review it in let's say 1 hour. It will be uploaded on the website and the YouTube channel, and the presentation as well will be uploaded on the website channel under the already mentioned and communicated C19 Information Hub section under the FIS website. Have a great day. Thank you very much for your attention, and have a good competition season. Goodbye.
Guess I'm the only one left. Bye, everybody.
Jenny, hello.